saying that shortly all the staff at Koori Medical Centre, the frontline staff, that's the doctors and the nurses and the administrative staff, you and me,
that's right,
we're both going to be ensuring that we have the immunisation, and we'd encourage all our patients to follow suit. There will be a lot of information coming out about the immunisation and when it will occur. What other things do you think we should tell our patients about this vaccine?
Yeah, so I think, I guess the first thing to cover that's really important is how the vaccine works.
Absolutely right.
And I think we don't need to go into too much scientific detail, but we can include links attached to this video that look into that if you'd like to. But essentially the way this vaccine works is it enables our body to recognise proteins that the coronavirus cells have on them, so that our body can seek them out and destroy them before they're able to infect us and make us sick. So it's really just giving our immune system a bit of a boost to recognise COVID before it's a problem. I guess the other thing that's important to highlight as well is the time it takes for the vaccines to become effective. I know we had a case with an New Zealand staff member who became infected after their first dose. So the evidence is that we need both doses and then a week after our second dose before we find that we have that effectiveness of the vaccine. So we need to give it that time to work.
That's good. Yeah. And in fact, after that second dose, and if you give it a week, you'll be 95, that vaccine is meant to be 95% effective, which is pretty good odds from my point of view.
I agree, pretty amazing.
We do expect for some slight reactions to occur, maybe fevers, headaches, a bit of fatigue, no more than maybe any other vaccine, and maybe on par, maybe slightly more than the flu vaccine.
Absolutely, yeah.
Now, if I have the vaccine, will it protect my family and my whānau from getting COVID?
Yeah, it's a good question. So what we do know with this vaccine is that it's got an efficacy of 95%, so 95 out of 100 people that get the vaccine, they'll be stopped from getting COVID infections when they have it, and that means the 2 doses in the week following. The thing that we're not too sure about is whether or not it can stop our transmission of COVID if we have COVID when we're getting vaccinated, so we're not too sure about that yet.
But the study's ongoing.
It's always ongoing.
It is,
that's right, yeah.
Every day we get more and more information about this virus.
That's right, that's right. And the other thing that people often wonder is if they've already had COVID, should they get vaccinated? And the evidence is absolutely, yeah, absolutely. We find that probably there's about an 8-month immunity period between having been infected with COVID and when you're kind of able to get infected again. So we definitely suggest that people, even if you've had COVID before, get vaccinated. We don't know how long this vaccine will provide us with some immunity, but we have every reason to assume it will be longer than at least the 8 months, and time will tell.
So, as we head into winter, and this is going to be a very busy time for us now,
yep.
We've also got the problem of the flu immunisation rollout plus the COVID immunisation rollout. Now, there are certain time gaps between the 2 immunisations.
That's right. So the kind of timeline that we're looking at the moment, so between the 2 doses of the COVID vaccine, we need 3 weeks between there.
At least 3 weeks.
At least, yeah. And for anybody who's keen to have the flu vaccine, again, another thing we definitely suggest people look at, you need at least 2 weeks between the second dose and for you to get the flu vaccine. There are other things that we're also trying to encourage our communities to take up, things like MMR vaccines.
Very
maybe
important.
Another video, but anyway. But you need 4 weeks after your second COVID vaccine before you can get the MMR vaccine and other vaccinations like that. But we can always help guide you through that process and give you some idea of when you're kind of eligible and safe to get next vaccinations.
When we talk to our patients, they often talk about some of the worries they have about the immunisation. What sort of things have patients been asking you, Mel?
I think a few of the big things that I've noticed with patients and concerns that patients have, I guess one of them is the idea that perhaps they're being injected with COVID.
Absolutely.
That perhaps this might have a change on their DNA.
Yes.
And also, you know, for some young women and people thinking about starting families, whether this might have an effect on fertility as well. Those seem to be some big things that I'm noticing. So really keen to take this opportunity to outline that this is not a live vaccine, so there's no active COVID in this vaccine at all, so we're not injecting COVID. There's nothing about this vaccination that alters your DNA either, and there's no evidence that this has any negative effect on fertility either, so put those ones to rest early, I think.
I mean, I think you've raised some very important points. This vaccine has been produced very, very quickly, and that worries a lot of people.
That's right.
But we should reassure the population, our community, that the vaccine has been produced with no shortcuts. Whilst it has been produced quickly, all the safety checks have occurred. The reason it's occurred so quickly is, and it's remarkable, governments all over the world, there's been a global collaboration to ensure the vaccine comes out quickly. And things have been done, rather than being done one after the other, things have gone ahead in parallel. Let's assume that lots of people take up the immunisation, which would be great, because that increases our chance of getting what's called herd immunity. Does that mean that's the end of it and we can just relax, and in New Zealand we can just go back to the way things were prior to 2019, December 2019? What else do we have to do? I
think the things that we hear a lot on the news and on the TV are still really important. So really good hand hygiene, physical distancing, staying home if you're unwell, and most importantly, as we hear, using that COVID Tracer app are still really important things to help minimise the spread of any kind of infection, but especially COVID.